across the country. And to do just that, I'm joined by Honorable Dr. Esther Mwinyangwe, who is the Deputy Minister of the Ministry of Health and Social Services. Thank you for joining us.
Thank you very much.
We are also joined by Dr. Charles Sagoe Moses, who is the WHO, World Health Organization representative in Namibia, here as well to join us. Thank you very much.
Thank you very much.
So would like to remind you again, viewers at home, as well as all those who are very interested around the health issues around COVID-19, to constantly get in touch with the Ministry of Health and Social Services through its toll-free number, which is 0800 100 100. And any queries regarding any of the sectors or the health sector around COVID-19 Namibia, to email us at MICT, and the email address is covid.nam@mict.gov.na, so that we're able to channel your queries to the panelists we have here, but also to respond to you as best we can when you have those questions. So let us get right into it, Honorable Deputy Minister. Just to give us an overview generally of where we stand so far around testing, around quarantine, around active cases, around these cases, around people who have recovered, and as well those that are sort of suspected and that you're still tracing.
Thank you very much, Honorable Deputy Minister Mathieu Fellas. Good afternoon also to the media practitioners and the listeners out there. Let me start by saying that the government of the Republic of Namibia, and in particular the Ministry of Health and Social Services, is working around the clock in response to the World Health Organization's directive to strengthen the prevention and control measures of COVID-19. This morning when I was here, I updated the nation, and I keep on doing that, and I'm happy to announce that we still stand at 16 COVID-19 cases. I'm happy to mention that 3 out of the 16 have been discharged. Before that, they were retested, and they did not show any signs of or symptoms of COVID-19, and hence they are regarded as recovered, and they were discharged. The 13 active COVID cases are still in isolation, and their conditions are reported to be in a good position. They are not critical at all, and so we are happy about that. And I want to mention that since the declaration of the state of emergency, we have seen more people coming or returning back to Namibia, and some of these people were students who were also studying somewhere else around the world, and we had like close to 300 people who were in quarantine facilities. Again, I'm pleased to mention that 34 were released from the quarantine facility, and upon release, psychosocial support and counseling were also provided to them. But we still have quite a number who are still in quarantine facilities. At Hartab Resort, we have 40, and all 40 at the moment do not show any signs and symptoms. At the Rock Lodge, we have 39. They also don't show any signs of COVID-19. Cross Barman, we have 22, with also 0 symptoms and signs. Sambesi Waterfront Park, we have 62, and 3 are showing signs and symptoms of COVID-19. Then we also have a number of 139 in other places around Windhoek, and out of the 139, 4 are showing signs and symptoms of COVID-19. So that is what I can say at the moment regarding the testing, the tracing. we know that case number 16 is a medical practitioner, and the concern is that he has been in contact with many people, patients, colleagues, and our surveillance team is hard at work doing contact tracing, because that is very important, to trace everyone who was in contact with the medical practitioner, as well as with case number 15, so that they can also be, put into isolation. And so that is ongoing. The testing is ongoing. And I'm happy also to mention that we have our doctor here from the case management team, and he will dwell more into the issue of testing. Let me also use this opportunity to appreciate our health professionals who are really committed and dedicated and work around the clock to provide the necessary services, as well as our community health workers, social workers, psychologists, and so on and so on. We are also very pleased to see how all the government sectors are really collaborating, and we are taking hands to deal with this pandemic. The private sector, the business, individuals, every Namibian who is making a contribution, it's highly appreciated. And as I have mentioned, we have Dr. Apollo Pasenoro with us, and when it comes to questions that relate to testing, case management, he will also back me up. So I want to say that that is the situation at the moment. We are happy to announce that we are still at number 16, and that is a good sign. We are also very happy that we can announce that 3 have been recovering. I thank you.
Thank you very much, Doctor. Perhaps just to clarify a little bit more, because I think there is some confusion. We got a lot of queries around the 3 that have recovered. Have they recovered from the virus in totality, or did they recover from the symptoms? You did say they are discharged. So one would say they are not symptomatic, and therefore they probably cannot transmit the disease to someone else. So just clarity on that, so the nation is aware of that.
Okay. So before they were discharged, another test was done. So that's why I'm saying they were retested, because that was necessary to make absolute sure that they are totally recovered from that. So at the moment is that they have recovered, they don't have signs and symptoms of COVID-19. So they are being seen as fully recovered cases.
Thank you very much. Dr. Charles, thank you again for joining us. Perhaps we could ask from the WHO side of things. We know you're working closely with the Ministry of Health, as well as the control disease centers around this matter in Namibia. What has been the World Health Organization's support at this moment, and how can we improve it to ensure that we contain the further spread of the virus?
Thank you very much, Honorable Deputy Minister. And before I start, I would like to salute all the health workers who are our frontline workers and are doing exceptional and sacrificial work at this time. Tomorrow is the World Health Day, and this day will be focused on nurses and midwives. And I would like to take this opportunity to salute all nurses and midwives, all health workers, all doctors, all community health workers, everyone in the health fraternity who at this time is devoting their time to help us fight the COVID-19 pandemic in Namibia. Secondly, to also put everything into context, that as we speak, over 1.2 million people have been tested, positive for the virus all through the world, and we have about 70,000 people who have lost their lives in over 200 countries as we speak. So when you look at that and look at what is happening in Namibia, it helps you to understand how we are doing. Now, so far as the response is concerned, there are various areas we need to pay attention to. And we have been advising that we need to protect ourselves. If I protect myself and you protect yourself, the whole nation will be protected. And we need to protect our families so that I don't go out and bring the virus home to infect my family. We need to protect the most vulnerable people in the population or society. And here we are talking, everyone is vulnerable, but we have a particular group that are most vulnerable, and they need special protection. And these are people over 60 years old and people with underlying health condition. And the most important one, we need to protect the health worker. Protect the health worker because, as I said, they are the frontline workers. They are those who are protecting us. So when the head of state says that we should stay at home, we should stay at home so that the health worker will stay at work for us. We should stay at home so that when they come home, they would meet us alive. And we need to make sure that whatever it takes to protect the health worker, in terms of making sure that the health worker has all what it takes to work, to feel confident and comfortable, to give us that care when we need help, is there. Then we need to make sure that we can isolate those who are showing signs and symptoms and test them. And when they are positive, we treat them. And then we trace everybody that they have been in contact with. Now, this is what we are advocating. And you can see that here in Namibia, the whole government has taken this up. Of course, under the leadership of the Ministry of Health, but look at us here, with the two ministries ably represented and the media. So it's the whole government approach as well as the whole society approach. This is a battle that can only be won if we pull in the same direction. Now, having said that, I just want to say a bit about the last question you asked, Honorable Deputy Minister. How do we know that the 3 people who we say have recovered are indeed recovered? So to be able to do that, we do 2 tests to check. After we see that they don't have any signs and symptoms, 2 tests to check that they are negative over a period of between 24 and 48 hours, to assure us that when they get back into the community, they do not have the virus to infect others. And this is very important, to give people in the community that these people are safe to come back to us. Because they've been in isolation, we have tested them at least 2 occasions to know that they are virus-free. So apart from not having any signs and symptoms, they don't have the virus. And I think it's important to assure everyone that this is what they can safely be integrated into their society and their families.
Thank you very much, Doctor. Just a quick follow-up. You spoke a lot about, of course, protecting ourselves in order to protect others, including healthcare workers. Of course, when the news broke that we got our first 2 cases and so on, there was a rush towards getting supplies, especially gloves and masks. And it seems the message worldwide is that this, first of all, is essential for healthcare workers, for them to be enough in a country to be used by actually the people dealing with those that have tested positive for COVID-19, but also that they seem to be used for certain instances when perhaps we have a greater risk exposure and so on. Just a little bit for the nation to really hear when to utilize the mask, when it's necessary to do so, or when to utilize the gloves and so on, or is it sort of mandatory to really protect oneself?
Thank you. Thank you very much. This is a very important question. And it's come up almost every time. And as I speak, there are discussions and very interesting debate and discussion, not only here, but all over. And WHO are aware of that. Just on Friday, we had a technical meeting and with experts discussing it. We are looking at all the available evidence, and then we are going to evaluate the use of mask, especially the use of mask for the general population. And once we are able to do that, we will come up with specific recommendations. However, let me take this opportunity to address key issues based on available research. The evidence we have to date is that mask, and we need to pay attention here, mask for the one who is sick, the one who is taking care of the sick, and the one who is not sick. Now, the one who is sick wears the mask to protect others, not themselves. Because they're already sick, they already have the virus. So it's to protect others who are not sick. The one who is taking care of the sick wears the mask to protect themselves from the one who is sick. So it becomes a barrier. Now, the one who is not sick, healthy, the evidence is that if the one who is not sick is doing the key drivers of this outbreak, like social and physical distancing, personal hygiene, hand washing, respiratory etiquette, etc., there is no additional protection if the person wears a mask. And this is very important. There's no additional. So once you're doing the right things, there's no additional protection if you wear the mask. Now, the second most important thing is that masks such as the surgical or medical mask and respirators, you may hear something, some people call it N95, FFP2, FFP3, N99. These are really made for the health system to support the health workers and protect them. And therefore, we need to prioritize their use for health workers. As I mentioned, we need, by all means and at all costs, to protect our health workers. Because if we lose them, already we don't have enough. So we cannot afford to lose any. So we need to prioritize their use for them. There are discussions on other homemade and cloth mask that you see on the social media, etc. These are what we are looking into to see how suitable it is for the general population. But as I said, the evidence that we have, once you're doing the right things, do not really have added value. Another important thing to remember is that sometimes when you have the mask on, you tend to have a false sense of security and protection. I have mask on, but bear in mind, the mask is not covering your eyes. Yes. If you don't wear the mask well, you are not benefiting from its protection. And so if you have it and you tend to, okay, because I have it, I'm okay, you are deceiving yourself. If you do the right things, social distancing, personal hygiene, hand washing with soap and running water, sanitizer, these are things that have been proven to interrupt the transmission. And that is why we constantly emphasize on that.
All right. Thank you very much, Doctor. I think the message is very clear around that, as well as from the DM of Health. I would now like to open up the floor for questions. I have a hand over there already. One. I'll just do a quick sequence. You can please join us here for you to give your question, so that we are able then to get into an engagement with the media practitioners here. Yes, you may.
Thank you so much. My name is Pancho Mulongeni, and I'm with the Namibian. My question is from an epidemiologic perspective, and it goes back to the fact that now we have 16 patients with the disease, but these patients came in a different, in a sequence that isn't indicative that they're all connected, or are they? So my question is actually based on the contact tracing that we've done, and also from what the patients have told the authorities, how many clusters do we have of patients do we estimate? And that would be to say, in other words, if you could draw a map of all the patients, are they all connected, or are some not connected? And I think that's important for us to know, because that will give us an understanding if we are getting cases that are from other sources than the first that we discovered. I hope my question is clear.
I think it's clear. Thank you very much. Should we get into responses for that?
Yeah. I have to mention that we don't have local transmissions. We have, and we also don't have community transmissions. So we have local transmissions, meaning that the people who are infected have been in contact with people who have been coming from elsewhere. And that is why it is so important for the ministry to make sure and to try its level best to prevent the spread of community transmission. And I know that the team from the case management also have started with sampling in order for them to see whether there are possible community transmission or not. And hence, I would love to call upon my colleague, Dr. Apollo Vasanero, also to share more light on this one.
Doctor, yes, you may take the podium just to respond.
Okay. Thank you so much, Honorable Minister. Just to add on what the Honorable Deputy Minister has said, At the moment, what we have is that we don't have any community transmission at the moment, because most of the cases, almost all the cases that we have either come from outside or they're in contact with someone who has come from outside. Yeah. So at the moment, we don't have community transmission. And this is really very important, because when you reach that level of community transmission, then things begin to get out of hand.
But how is the contact tracing going in determining those, either those that got the virus from someone who was outside, or they themselves got it from outside and brought it into the country? Now, the people they were in contact with, how is the contact tracing coming along to determine whether or not there has been this community transmission or not?
Okay, thank you so much, Honorable Deputy Minister, for that question. So at the moment, we have a team of our surveillance officers. So what they do is they get a list of possible contacts with someone who is confirmed, and then they try to track and trace these contacts. So once the contacts are traced, then there is what we call isolation or quarantine. So those contacts are told to quarantine themselves, because at that moment they all don't have to be tested for COVID-19. It's only when they fit the case definition that then the testing is done. Yeah, so once the contacts are identified, then they are self-isolated. They are told to self-isolate and then monitor the surveillance team continues to monitor the signs and symptoms of those contacts. If they meet the case definition, then that's when they are tested for COVID-19.
All right. Yes.
I think the point that the Honorable Deputy Minister and Dr. Apollo have made, I think these are very important. And that's why I started by saying that the strategy is really, we need to isolate, test, treat, and trace. You know, because most of the cases we have are coming, invariably, all the cases are coming from outside. So these are imported cases. Now, what happens once they get here, it becomes important. Now, if we are not able to trace their contacts, it means that we are losing into the community. So the team is working 24/7 to make sure that every contact has been traced. Because unless you trace a contact, then you have a loose end. You see, once you get all the contacts, the whole idea is containment. And to be able to contain, you need to ring fence the index case and all the other contacts. You quarantine them within the incubation period. So if there are any signs, then you can isolate them as well, test them, you treat them before they move into the community. Because once we get into the community, then we have exponential increases. They are not just 1, 2, 3, it's like a bomb. Wow. Because one person can infect between 400 to about 500 people if you don't do your contact tracing well. So this is a very important point that we should take note of. And that's why, as an individual, you need to make sure that you are protecting yourself. Because imagine I have the virus, and I have 2 people in my home. If I infect them, they also go out. In my office, I'll say about 50. I infect all of them. The 2 infect about 20 each. So already we are talking about 90.
Yeah.
Each of the 90, if even they infect one person, from me alone, within a short time, I've successfully infected over 500.
Thank you very much, Doctor, for that. Next question? Yes, ma'am.
Good afternoon. My name is Jemima Beekers, Namibia Media Holdings. Dr. Moses, can you please explain to us what exactly is meant with asymptomatic? And then there is also the concern from some people that some of our positive cases are isolated at home because they are asymptomatic. I also want Dr. Esther, can the ministry please tell us how many ventilators we have at this point? I know that 2 or 3 weeks ago, the ministry received 10, and you have now put in an order of 88. But how many do we have right now as we stand? And then obviously, these ventilators must now be divided amongst the COVID response and the everyday ICU patients. Then also, it is widely said that comprehensive testing is key to fighting coronavirus. Now, we also need to, I would like to know, the ministry last week said that the ministry will start to test people with underlying issues, respiratory issues. So can you also give clarity on that? How would that be done? Do people have to line up? I mean, do you have to register? How do we go about in terms of this? Thank you very much.
Thank you. Anyone would you like to start first? Yes.
Okay.
Yes, Dr. Moses.
Okay. Thank you very much, Jemima. Asymptomatic, as the word implies, means that you do not have a symptom. And likely, you may have the virus, but you do not have a symptom. So we have asymptomatic, we have pre-symptomatic, and we have symptomatic. So you could have the virus, you may not have the symptoms, but then you may be getting there, and then you'll be in the phase of pre-symptomatic, and then you become symptomatic. In this pandemic, most of the transmission occurs during the symptomatic phase. There are, we are aware of some small proportion which could be attributed to asymptomatic, where you don't have the virus, you don't have the symptoms, but then you are transmitted. Because, again, if you look at the mode of transmission, the mode of transmission is basically through speaking, sneezing, coughing from your droplets, which lands in the face, the mouth, the nose, the eyes of someone, or on the surfaces where you may touch with your hands, etc. So you've got to be symptomatic, you see, to be able to pass it on. So mainly, at least from the literature and from the countries that have that started with, this is what we know. The tricky point is pre-symptomatic, where you may even have some of the symptoms. Well, you may have maybe a slight headache, you are not sure of it, etc. But really, it's asymptomatic that transmits the disease. Was there a second one for me?
Ms. Jemima, could you please go to the podium so the audience hears?
Now, the concern is, you've also said that a fraction of these people that are asymptomatic, they may transmit the virus. And yet we have some of the positive cases in Namibia that are self-isolated. Is this not undermining the fight against coronavirus?
Okay. When you talk about isolation, as I said, the first attack is you isolate this person. You test, you treat, you trace. Isolation is so important. So if the person is being tested and is positive and is isolated, that is the right approach. You see, the principle is isolation. The approach is, where do you do the isolation? Do you do the isolation at home? Do you do the isolation in an institution? That depends on the level of illness. If you have an underlying condition, etc., you are positive, you are better off in an institution, in a hospital, so that you are monitored. If you have a mild, disease, or you are asymptomatic, and you are positive, and you are in an environment where you can self-isolate, where you can be monitored from where you are, perhaps it's better so that you do not overload the health system, so that those who really need the care will be in the institution. So, once we separate the principles from the approaches, it becomes a little clearer. The principle is isolation, the approach is institution or in self. But even self, you have to determine whether this person, I live in Havana, I live with 5 other people in the same room, and you're asking me to self-isolate. It doesn't work there, But maybe deputy minister lives in a place where there are only 2 people or 3 people, so she can self-isolate. You see, so the situations are different, and you have to look at everything together so that you can apply the right approach to the principles.
Thank you very much. Dr. Mwinyangwe, there are some questions to you as well.
Yeah. Let me try to answer the question on ventilators, but before that, specifically on the ventilators, let me mention that in this critical situation or time that we find ourselves in, we are not only, talking about ventilators. It's not the only thing that is in need, but we also, we can talk about testing kits, PPEs and so on. So the ventilators, you are right when you say we have the 88, but I know that there is also a donation that was that came from UNICEF. Unfortunately, I cannot say the exact number of it. So it's something that we are also looking at and working on it, because we know that it's something that is needed. It's one of the equipment that are needed. So we are working on that one as well, to make sure that when we reach the, a critical, very critical situation, we should be able to handle the situation. And the testing, do people need to line up?
Ms. Jemima, but maybe the technical person,
Yeah.
Dr. Apollos, can respond to that one.
Okay, thank you so much for that question about testing. If I got you right, currently what we are doing is called targeted testing. Targeted testing, basically we are looking at the case definition, and whoever meets the case definition, then they are tested. But as the pandemic, depending on the number of cases we are getting in Namibia, that might change because there are other tests that are coming in, the rapid tests. So the modalities of testing might change. As you've seen, some other countries have drive-through testing services, but we have not reached there. At the moment, what we are implementing is targeted testing. Maybe also to just comment on the issue of ventilators, what we need to know is that when you have a number of people who are infected with COVID-19, almost 81% of those individuals are mild cases. So they just need maybe symptomatic treatment, paracetamol if they have fever. Then you have around 14% of those patients who are severe, meaning that they will just need oxygen in the hospital and other supportive medication. Then it's only 5% that are critical, which will need ventilators. Yeah, so part of the case management, what they've been doing is just to estimate the number of people who might become critical and need ventilators. So the case management team has been working on that, working together with the public and private sector to see that those who are critical, we are able to manage them. Yeah, thank you.
Doctor, perhaps just a follow-up to that one. So this targeted tracing is aimed at people with, respiratory issues. Is that part of the targeted package you would like to invite?
Yeah, thank you so much for that. Yeah, so the case definition clearly lays out someone who is a suspect. Okay, so a suspect, we are talking about someone who is having maybe fever, cough, and difficulty in breathing, and has a history maybe of contact with someone who is confirmed or traveled to a country where, you know, there are confirmed cases. Yeah. So we have clear case definition. So the targeted testing is looking at those individuals who meet that criteria. For example, if I go to a facility and I just have only cough, I don't meet the case definition, so I'm not tested for COVID-19. And something we should also remember is that the supplies for the tests, we don't have a lot of supplies to do these tests because there is a lot of demand in all countries. So all countries are looking at these tests. So out there in the market also we have limited supply of tests. That's why we are strict at the moment on the case definition.
Okay. Thank you very much. That's very clear. Perhaps one last question from the floor, or two last. Okay, and 3 and 4. Okay, ma'am, the floor is yours.
Good afternoon. The distinguished panel. My name is Hilda Baswana Manjebo, representing the Patriot newspaper, an online newspaper. I have a few questions, and I'd like to ask you, Dr. Charles, I'd like to ask you the first question. Perhaps the doctor would also be able to assist. I'd like to know, I see that with most of the countries, they have a peak day. They anticipate, for example, South Africa says that they think that in June will be their peak. And therefore, they then have created certain, I guess, ways, modalities to deal with that peak at such and such a time. I'd like to find out, when is our peak expected to be, and how have we prepared for that specific time, just in terms of case management. And then also, Dr. Esther, good afternoon. I'd like to know from you, Namibians I find are very interesting people. We have a way of settling into something very quickly. I think already for me, I can see that we're not quite as aware as we were about when the president announced lockdown a few weeks ago. We've become a bit chilled about it. We see the cars that are driving around Windhoek. Let's not even fool ourselves. There's really not a lockdown really happening in Windhoek. We walked into this venue now, and we did not get the opportunity to be sanitized. We just walked in. And this is a room where that should be on a heightened alert. We should be on heightened alert. So I'd like to know from you, Dr. Esther, just from a mental health, psychosocial perspective, what's the message that you would have to Namibians? Because I guess it's when we lower our defenses, is exactly when the virus really sneaks in, and really, at the end of the day, we sit with huge numbers. So if you could maybe just address that peak day, what have we done to prepare for that day, and just the message that we have for Namibians at this stage, you know, just to keep their alerts up. And then the health professionals, a third question. Oh, sorry,
please. We're running out of time, so just quickly.
Yes. A third question, just about the health professionals. We know that one was positively identified last week, a health professional. I'm not sure if it's a nurse or a doctor, but that was one of the statistics we got last week. And we understand with reason that the health professionals, obviously, who work with us at the hospitals, they were panic-stricken. How are we helping them from a psychosocial support perspectives specifically to help them to continue to go back, because we're not even in the peak yet, but they have to continue to go back to treat us. Thank you, Honourable.
Thank you. Can I just ask the second journalist to ask the questions so we take those as a group?
Good afternoon. My name is Francis. I'm from NBC. My questions are directed towards Dr. Munyangwe. I just want to find out, in terms of like supplies like gloves, face masks, hand sanitizers, does Namibia generally have enough supplies? Taking into consideration that South Africa recently decided to ban the export of face masks and hand sanitizers. So we just want, obviously they can still export, but with a special permit. But then basically how prepared are we in Namibia? The second question, no COVID-related deaths have been reported in the country yet, but say the country does then report a death, how exactly is this going to be handled? I know it has been released that the ministry will be taking care of all COVID-related deaths, but maybe we just wanted, to take us through the process from maybe the declaration of death until the disposal of the remains. And then my last question is, how prepared is the country also in terms of a possible breakout in the informal settlements? We all know these areas are well known for having limited facilities. We're talking about, running water, electricity, proper sanitation. So, and communities, businesses, and the government or local authorities have actually been doing what they can. But then, is it enough? And if a breakout were to take place, how are we going to handle that?
Thank you very much. Yes, Doctor or DM?
Yeah, I can. Okay, I think there are 4 questions or 5 that were directed to me. The one is on the message to the Namibians, and I think I will keep that one for my concluding remarks. And I want to go to the psychosocial support, if I got the question right, to our health professionals. Yes, we are fully aware that we are putting our health professionals at risk because they are the frontline workers, and globally we know that they are at high risk of getting infected with any virus or disease, because when the person presents himself or herself at the health facility, one cannot tell whether that person is infected or not. And that is a situation that they find themselves in. And that is why, from the start, we have been saying that to deal with this pandemic, we need all sectors of our communities. And that is why our health psychologists and social workers have been deployed as well, so that they can also provide, counseling, help people to calm down. So they are working with the health workers, providing the necessary psychosocial support. On the issue of the hand sanitizers and gloves, whether we have enough or not, of course, as a country and all the countries elsewhere, no one was really prepared for this. No one expected that we will have a situation like this one. But we are doing our level best, and that is why we are also encouraging people and retailers and all businesses also to make their own, because people can also make hand sanitizers. It's not necessary that we just have to buy from the shops. So, and I know that many people in their homes, they have their homemade hand sanitizers. The death or burial that are, related to COVID-19, of course, we will deal with that as a state funeral. But of course, from the time that the person passes on, the government will know, we appreciate and we know that we have different cultural and traditions in Namibia that are also dealing differently with a death in the family. So we will appreciate that and we will acknowledge that. So the government will not just go and take the body and bury it, but there will be consultation with family members, because the family members, in the first place, they are devastated, they are grieving their loved one, so they need to be provided with that necessary support. So they will not be ignored at all. There will be consultations to talk to them, to try to find out from them where do they want to bury their loved one, what time, which day, and so on. So it's not only a matter of government taking the body and bury it, but the family, of course, will be consulted. And the reason why any COVID-related death would be a responsibility of the government is because the body would still be infectious. And to prevent that, it's why the government is taking responsibility. And that would not be the first time, because in cases of Ebola, for example, these are also funerals taken care of by the government. The breakout in the informal settlement, are we ready for that as a country? I said that the government, all sectors are trying their level best, and we are monitoring the situation, and we are learning also lessons from other countries, and that is helping us to prepare for ourselves for the worst case scenario. So at this moment, I would say that one would not really wish and hope that we will come there, but should we come there, it's a matter of all sectors pulling their resources and expertise together and deal with the situation. Yeah.
Thank you, Honorable. Dr. Moses, big day.
Okay. Thank you very much. Before I answer, let me just say something small about the informal sector, because it's very important. I think that for the informal settlement, we need to actively engage the community. And as I speak now, I know that part of the response team is doing that. But let me also appeal to the media and others that let's really engage them, not as if we are telling them what to do, because they have their networks, they have their systems, they know what works, they know how they operate. Let us listen to them. Let us find solutions with them, because if we give them our solutions, it won't work there. So we need to really sit down with them and say, look, what can we do? What are the ideas you can bring forth? We have very able community leaders there, community networks that are working, and we should make use of them, rather than we do something and we give to them. We in the past would prepare even leaflets, information, etc., and say, here you are, use this information. They have community slangs, community language, which we don't know. Therefore, let us sit with them, plan with them, implement with them, and evaluate with them. I think that is the only way we can really reach out and then make a difference.
Big day.
Then my question about the peak. The peak, you have to look at two things. We use modeling to predict when you get to where, and secondly, the response. So, for instance, you look at how you are moving, the rate, and you look at where you double. Where is it like we started with 2, and suddenly within a matter of a few days we are at 8. Are we going to remain there? And then we also take into consideration the factor of community transmission. Because once you get into community transmission, then you are you are not ahead of the virus. So the idea is to get ahead of the virus. Once you're ahead of the virus, you can detect. But if the virus is ahead of you, the virus will tell you what to do. And so all this information are factored into your modeling to see where you are going. So with the peak, you reach the highest, and then you start, coming down. Yes.
All right. Just final words from the both of you, just in 30 seconds, to the Namibian nation.
Okay. As concluding remarks, I want to emphasize that our community health workers are also in those areas, like the informal settlements, and they are not doing the usual work that they have been doing, like taking the blood pressure and testing sugar and so on. But they are also now, serving as, they are performing a linkage role, because many of the people in the informal settlements, we know that they are also illiterate people. So they are there to link them with the necessary resources. And they are playing a very important role to educate the people also about COVID-19 as a way of trying to prevent that. And as a final message to the community, I want to say that as much as we are in a very critical time now, we should also learn to take these challenges and turn them into opportunities. It's time for us now to start thinking divergently and thinking outside the box. And you see that people are now becoming more creative and innovative. We see the tippy taps that people are creating and so on. So my message to the people out there is that we are all in this. And I am responsible, you are responsible, we are all responsible to take care of ourselves. And when we say stay home, it means stay home. It's not a matter of, for some people who think now, it's holidays, it's time for me to, and you still see movements in the streets. And I really want to use this opportunity also to comment the residents of Arandes, because I was listening to the news last night and they were clear that there are no movements in the streets, people are adhering. So it is our responsibility to make sure, because the virus is of such that you don't know the person that you are visiting, where has that person been, where did it touch, So it's very dangerous. It's the reality that we are finding ourselves in now. And we all have to take responsibility.
Thank you very much, Honorable. Yes, Doctor, very short.
Yes. Protect yourself. Protect your family. Protect the vulnerable in society. Let us all together protect the health worker. And we do this if we would wash our hands with soap and running water, or use sanitizer. We practice respiratory hygiene, we cough into your elbow. We maintain the social or physical distancing. And we make sure that if we are not well, we don't go to where people are. If you are not well, report to the health facility as soon as possible. This will be my concluding remarks.
Thank you very much, Doctor. That's all the time we had today, viewers at home. Those are listening in on all the platforms available. I'm sure all the media houses are streaming this to ensure that the message gets to you. Please do not forget to contact us through our email address for all your queries and questions that we'll address here, as we have our morning brief at 10 and afternoon brief at 4 o'clock. But also please make use of the toll-free number, which is 0800 100 100 of the Minister of Health and Social Services, to ensure you get clarity on any issues. Thank you. That's all the time we had today. Please join us again tomorrow morning at 10 o'clock as we delve into higher education as a sector on how COVID-19 has affected students in universities. Thank you very much.